Everybody, welcome back to my channel. I am Muriel and this is As Told by Muriel, and today I am back with a life update. So y'all, let's just get into it. On my last video, I told y'all that I went to a couple interviews for acute care facility. I am trying to return to acute care part-time, 2 days a week, to kind of brush up on my skills, learn the charting system, Epic. Some of you may not know, but Epic is an EMR system that is widely used across, I know, the United States. I don't know about other countries, but across the United States, it is widely used. So on the last video, I think I told y'all I went for an interview, thought I did so well in that interview, didn't get the job. The next interview, no one even showed up to interview me. So of course, didn't get that job. And at that time, I was getting kind of discouraged because I wasn't used to not getting a job that I interviewed for. That was, you know, foreign to me. It's never happened. So, and I told y'all I had another interview for this past Tuesday. I think it was July the 19th. It was in a level 2 trauma facility on a neuro unit. So guys, went to that interview, got there, everything was fine, you know, sat down for the interview. I don't know why, anytime I go for interviews, I always end up talking about geriatric care. I guess because I always work with the elderly or whatever. You know, they ask you different questions, and give y'all a heads up. Some of the questions that I've gotten in a couple interviews is, where do you see yourself in the next 5 to 10 years? What made you decide on this floor, this specialty? Were there ever any instances in your career where you had to basically reprimand, or how do you deal with delegating tasks, things like that, things of that nature? And I answered the questions. I thought I answered them fairly well. Then they asked me if there are any questions I had, and I asked them, you know, about their charting system and everything, because the last facility I worked to, they were using Cerner, which is also widely used, but they were utilizing Cerner. And before I left that facility, they were about to transition over to using Epic. So anywho, left that interview when they told me they used Cerner. It kind of put a little damper in me. Like, they were transitioning to Epic over the next 2 years. So the more she was telling me about the floor, the more I was like, okay, everything sounds kind of typical of where I came from. She asked me, why did I leave that company? And I told her, you know, I was just really extremely stressed out. The acuity of the patients, things like that were just really getting to me. And, you know, basically asked me, why do I want to come back into acute care after doing long-term care for so long, you know? And she could tell from my interview or whatever that I seem to like long-term care. And I told her, well, I feel like I'm losing my skills. I want to learn a charting system. Didn't mention the insurance. That was a main factor. But, so I left that interview. Actually ended up talking about, you know, telling her the fact that I actually thought I was interviewing for the medical surgical floor, not the neuro floor. But anywho, left that interview, wasn't feeling like, okay, it was like, I was feeling whether I got it or not. Oh, well. Actually talked to HR after I left that interview and was on the phone with HR saying, can you just give me an interview with medical surgical? And then we were talking about the pay rate and everything like that. And being that I wanted to work Saturday and Sunday, she was telling me that they have a program there that if you work every Saturday and Sunday, you get day shift for extra $12.50 an hour. Evening shift gets an extra $15 an hour, you know, plus whatever your base pay is. So that sounded kind of tempting. And then, you know, even though you're part-time, which is 24 hours, for them, it's only 24 hours. Remember that other facility, you had to do 30, and there was no way to do 30 without coming in 3 days a week. But for them, 24 hours, and you qualify for full-time benefits. So that was a win-win. So that kind of like trumped the EMR system for me. But anywho, y'all, I waited. You know, normally the next day you'll get a word back, didn't hear anything. The next day, didn't hear anything. The next day, got a message from the HR recruiter lady, and she was like, do you want me to set up an interview with you with medical surgical? So then I kind of knew, okay, well, they must not have liked me at neuro. So and all that, y'all, I didn't get that job, y'all. So now it's like, it's not a blow to my ego, but I'm just like, okay, well, what did I say in that interview that they didn't like. I didn't understand, but anywho, didn't get that job. Not upset about it at all, y'all. Not upset about it. I did kind of feel like, oh God, this is not going as bad as they need nurses out there. This is not going like I thought it would. But I didn't leave there too discouraged, because for two things, they didn't use Epic charting, and it was neuro. I really didn't want neuro. I want medical surgical. And also the facility was 1 hour and 20 minutes away. So it would have been a drive for me, even though I was only going to do 2 days a week. I was going to stay in a hotel in that area and then come back home. So I'm not really torn up about it, but it got me thinking. I was like, girl, you're doing all this. Y'all not going to believe what I'm about to say. Because I didn't preach against this, but I was on my soapbox against this. But I was like, you doing all this, girl. Just go back to the facility where you came from. You left there in good standings. There was no animosity. Of course, you know, you were miserable. You was miserable as heck. But they now use the charting system you want. You can go in there on day shift and not night shift. Maybe night shift was one of the reasons why you were feeling the way, the misery and things that you was feeling. You're only committing to 2 days a week, which is Saturday and Sunday. Just go back. It's right. It's like 20 minutes from your house. It's right there. You already, you know, you familiar with the floor. You're familiar with the nurse manager. You know you were a good worker. Just go back. So I sent my nurse manager a text message because I still had her number in my phone. And I asked her, you know, is she looking for anybody to work weekends? Was she looking for anyone to work weekends on her floor? And she was like, you know, well, she could use somebody. Do I know anybody who's interested? And I told her I was. And I asked her, well, was I rehireable? I said, well, I'm interested if I'm rehireable. And she was like, oh, yeah, of course. She was like, I don't have anything posted, but just go online, fill out, do an application or whatever. Let me know when you're done and I'll pull your application, call you in for an interview. So I did the application. I just pulled it from some random unit. Because, you know, they have different units posted. So I just did an application, did my resume for some random unit. And today I got a call from that unit. And that unit, they wanted to set up an interview with me, which the unit was like, it's called Critical Decision Unit, CDU or something like that. And on that unit, because when she called me today, I was like, oh, I did the application, but I did it for another unit. I did it on your unit, but it was for another nurse manager on the floor that I previously worked. And so, and I asked her, well, what is this unit anyway? I've never heard of CDU. So CDU, she told me, was Clinical Decision Unit, where a patient comes in and say a patient is having chest pains or had a TIA or, you know, maybe have a low hemoglobin or things like that. Before they admit you to the hospital, they'll put you on this floor for observation. Now, on this floor, I'm told they do, you know, give fluids if needed. They do lab work. You know, they monitor you, hook you. I'm not sure if they hook you for tele for your chest pain, but they kind of monitor you to determine if you need admission. So you're not actually admitted to the hospital, but it's like it's like an observation pre-admission type thing. And I was like, oh, that sounds interesting. I'm thinking, dang, that'll really boost up my assessment skills. But you know, loyalty first. So I told her it sounded interesting, but I actually did my application for, you know, my former unit. And so she was like, okay, well, if you become interested, you know, just let me know. She told me what her name is. She told me the nurse manager on the floor that I was actually going to knows her number and all that. So just contact her if I'm interested. So y'all, I go for my interview for the floor that I used to work that just stressed me out. And this is just a nod to where you always want to leave a place in decent standing. When I left this facility, you know, y'all know I had transferred off that floor and just couldn't get on the new floor because of the pandemic happening. But I worked out my 30 days notice. I explained to her why I was transferring when the pandemic happened and I couldn't transfer. I explained to her why I was just going to go ahead and resign. You know, how miserable I was, the acuity of the patients and all that. And so I worked my notice out, and yeah, so I left there in good standing, and it looks like I'm going to be ending up going right back to that facility, which I'm not mad about it. I kind of feel like now that I'm day shift and not night shift anymore, I may not be as miserable. I may not be miserable at all. I will learn more because, like I said, I worked there for 7 months, but working night shift, it's a lot of things you don't do that they do on day shifts. Like I didn't do the roundings with the doctors. I didn't do discharges. There's a lot of things I have no experience with that I want to learn how to do. And even though I worked there 7 months, anybody will tell you 7 months working as a new nurse in acute care, you're not really, you're learning, but you don't have anything. Like I can honestly say, as I replay things in my mind, I cannot even remember how to set up the IV pump. Well, not set up the IV pump, but like how to do change the settings for a heparin drip. I don't remember that. I don't remember a lot of things that I'd learned in the 7 months I worked there. And now they have a new charting system, which is epic, which, you know, I really want to learn. And so it's going to be kind of brand new for me walking in the door. I don't know if I don't think she's going to put me on the 12 weeks of orientation, but I'm told from a friend of mine that I probably do need to do 4 to 6 weeks because of the new charting system. She's like, it's a lot to learn. It's way different than Cerner. Give yourself 4 to 6 weeks to learn this charting system. So yeah, a little known fact that y'all probably do not know, I do not have the vaccine. I opted out of getting vaccinated, y'all. Have my own personal reasons why, but I did not get vaccinated. I kind of wanted to wait just to see, you know, if anybody turned an I Am Legend around here, how you see how, you know, everything works out. But we're like, we're probably about 4 to 5 months in of vaccinations now, and yeah, there have been some adverse effects and things, but I kind of feel like, okay, well, I think, you know, I'm going to try to plan out when will be the best time for me to be sick. This is the type of way I'm looking at it, because, you know, I'm told a lot of people that first shot really doesn't do you much, you know, but I heard the second shot. I know a few people that second shot has really put them down on their tail. So I'm going to go ahead and look at the calendar and figure out when would be the best time for me to be sick. So yeah, I am going to go ahead and get vaccinated. You know, I'm not an anti-vax person. Somebody accused me of being an anti-vax person. Nobody here on YouTube, but somebody accused me of being anti-vax. And I was like, how can you say that when I get the flu vaccine every year? I'm not. If you like this information, and I'm going to get back into like doing some videos about new nurses, what to do, what to look out for, especially new LPNs, because a lot of them go into long-term care. A few of them do go into the hospital setting. I know nothing about doctor's offices, so I cannot help you with that. I know absolutely nothing about doctor's offices, but I'm going to start doing more videos for things you can do when you're coming out of school, because we got a new set of graduates to be coming out, next month. Yeah, so I'm going to start back doing videos like that. But if you like this video, please hit that subscribe button. Well, hit the like button, subscribe to my channel, and also I'm gonna leave a link to my new channel that I'm starting. It had one name prior. I actually put a video up and got locked out of that channel, and I cannot get back into there, so I had to start a whole new channel with a whole new email and everything. And this channel is going to be called Memory Lane. I will leave the link in the bottom of the description of this video. I'm going to upload a video on that channel too. That channel is going to be based off of, you know, just really dedicated to historical events, because I love history. I've said it several times. I love history. And so it's going to be a channel just going down in memory lane. I want to, you know, find my village. This is my nursing village, but I want to find my history village. Those people who love history and historical events just like I do. If you are that person, just go ahead, hit like and subscribe to that channel. And until next time, I am Muriel, and y'all be blessed. Bye.